Welcome to the Krista Escamilla Show.
Hello, everyone. Thank you for joining us for this week's episode of the Krista Escamilla Show. As always, I'm grateful you're here to listen, learn, and grow. And boy, are we going to do that today. I cannot wait to introduce you to our guest. But first, of course, I want to thank our sponsors for letting us share the amazing stories of West Texans. So a huge thank you to Omni Midland Hotel, to Rig ID Workwear, to The Preserve, which is under construction right now, so excited. Also the Laughlin Hotel, Thin FR, Midland Cap Company, and JoinCapClub.com, and Kevin Foreman of Foreman Financial. We appreciate your support in our show, and we appreciate you supporting local, so thanks for being here. Speaking of local, we are so excited to share today Dr. Adrian Billings' story. Dr. Billings is a husband and father first, but I love this title. He is a rural health cheerleader. Thank you so much for being with us, Dr. Billings.
Thank you so much for having me.
Well, first of all, I can't wait to hear your story. I've heard so many nice things about you. I just have to say that everywhere I go, when I say you're going to be on this show, I even had a text this morning from one of your employees, and they said how fabulous you are. So thank you for sharing your story today. Where does it begin? How'd you get to West Texas?
Yeah, well, thank you for that very generous welcome. So, I'm a West Texan, born and raised in Del Rio, and left West Texas begrudgingly to go to college, and wanted to become a veterinarian. And somehow, kind of along the way, I worked in a hospital in Del Rio one summer when I came home, and worked with a family doctor that delivered me, and they treated me like a third-year medical student. So went back to Texas A&M knowing that I wanted to be a rural family physician.
I love that. You knew right from the start.
Yeah, well, in college anyways.
Right.
You know, I worked for a veterinarian in high school, and that's really where my interest in medicine, became. And I realized that I really love animals, but I don't like sick animals.
Right.
And so then, that experience that was very impactful that summer home in Del Rio at Valverde Regional Hospital at the time. And that's, really where I went back and decided I wanted to go to medical school. And so, went down that path, and really glad I did. And I accepted a National Health Service Corps when I was a scholarship from the federal government when I was accepted to medical school, because I really knew I wanted to return to West Texas. And that scholarship is for underserved areas, such as rural and frontier areas like ours out here. And went to Alpine as a medical student. And I had a great aunt who lived there, and wanted to spend some more time with her, but didn't realize that would be the beginning of my recruitment back to Alpine. I returned for a second month a couple of years later in medical school, and then I came again in residency. And then when it came time to choose my place of commitment, repayment to the government, I was married at the time to my wife, Susan, who's a physical therapist, and I gave her 51% veto of the choices that we had.
Smart man, I have to say.
Yeah, yeah. Thankfully, and
take notes if you're newly married.
Right, and thankfully, she chose Alpine, even though she had no connection to the area other than my family and I. And it's been amazing. And so that was 18 years ago. We arrived in Alpine in 2007. I had a 4-year federal commitment, and just knew, we came with 2 kids and have 3 children now, 2 that are in college and 1 who's an 8th grader. And 18 years later, we're still there. And really, about 10 years ago, I started having this second calling come into my life. I really thought I was going to be a rural family doctor, delivering babies, house calls, and getting involved in the community. But about 10 years ago, this kind of rural health workforce development calling came into my life, as all the struggles that we've had in rural areas of recruiting everybody from a nurse to a physician and everybody in between that is so needed on that healthcare team. And so began getting more involved in practicing medicine outside the walls of the exam room, and kind of advocacy work. And Tim Benton was my chair. I was a part-time faculty member beginning, I think, in 2012 with Texas Tech Health Science Center. Hosting medical students and residents, really enjoyed that and learning from them, and helping me, do the work that's needed in the hospital and in the clinic. And so a couple of years ago, decided to come on board full-time to Texas Tech Health Science Center, really working on rural healthcare access to care issues, and also trying to get our trainees out for more rural medicine exposure, hoping that they will choose to serve rurally when they're done. So.
I know it's so important. Everyone deserves great quality health care,
Yeah.
right? And when you say rural health care, let's talk about some of the challenges and that maybe that was part of your calling and why you went toward that.
Yeah, so rural healthcare, I think maybe what everyone doesn't understand is especially if you're not from West Texas, is the distance between our community, especially out in the Big Bend, that you have to travel if you're in labor to get to a hospital.
Yeah.
If you're traveling from Presidio, it's 90 miles to the U.S. hospital. It's 2 miles to the Mexican hospital right across the border. Or if you're coming from Candelaria, 60 miles upriver from Presidio, it's 150 miles if you're in labor or if you've had a stroke or if you've had a heart attack. And then the facilities, they're just small and under-resourced. And most of them are staffed by family medicine physicians like myself. And, these rural healthcare facilities are lucky if they have a general surgeon or an obstetrician gynecologist specialist. And oftentimes if a patient shows up in a critical condition, then they need to be flown out. And oftentimes it's here to Odessa or Midland. Sometimes it's El Paso, and other times it's Lubbock. And so, access to care is a challenge, and providing that care in the areas and trying to provide evidence-based care that's the standard of care when you have vital team members that are missing.
Yeah.
During the pandemic, we had to close our labor and delivery unit at the hospital in Alpine because of a shortage of labor and delivery nurses.
Wow.
And we were having...
But babies were still happening.
They were still happening. Labor was still happening, and we would have to deliver babies in the emergency room if we could not transfer them out up here to Odessa or to Midland. And there were times where we had patients on ventilators during COVID, and we did not have an ICU, and I certainly am not an intensivist, an ICU doctor, but we could not transfer patients out in a timely manner, many times. But those are some of the challenges.
Yeah.
But the joys, I think, that I share with trainees is really you become part of the community as a healthcare clinician, whether you're a nurse or you're an advanced practice clinician or you're a physician like me. I mean, I'm a family medicine specialist by training, but I really consider myself a community physician. And what that means is really getting out in the community and practicing medicine outside the walls of the healthcare facilities and trying to become a community leader. And one of the privileges that I've had is to be elected as a school board trustee. And so 9 years ago now I was elected for my first term and have continued being reelected and have really enjoyed advocating for rural students so that they can have an equitable academic opportunity to achieve their dreams and go to college if that's what they want to do, or trade school, or become a physician like me to join me and maybe replace me someday. So I've really enjoyed that community aspect, running into patients at the grocery store and walking by and sometimes hearing, "That's my doctor," when somebody whispers to whoever they're with, or when a patient comes up to me and says, "Hey doc, did you get that lab result back?" And maybe I hadn't called them back yet, and just doing a consult in the grocery store. And it's funny, my kids and wife know that when a patient comes up and asks me a question like that, they just scatter.
They scatter.
In all different
They're
directions.
Like,
so, but that's some of the joy. I was
that.
at yesterday I was in Alpine for a Colorado State University career fair, but last night was a Alpine Middle School band event, and it was my last son's last middle school end of year band event. So it's a little bit kind of emotional. He'll be going on to high school.
Those lasts always get you, right? They get a tear in the eye.
That's right. But just watching him in the band and looking at all the kids out there that over the past 18 years that I've delivered, and seeing the parents and just thinking of the care that I've provided to them. It's very personable care, and I really think that many of my long-standing patients, they're not just patients. Yeah. They're almost like family somewhere in between them, because you know their kids, and oftentimes multiple generations see you, and so it's an incredible privilege that I've had to be a rural physician in spite of the challenges, the joys far outweigh those challenges, and are the reason that I'm commuting up here to Odessa, to campus a couple of days a week, and I still live and practice in Alpine a couple of days a week.
I love that. I think it is. I bet it's a very rewarding job, and the blessings come, not only to your patients but to you as well. What would
my family
and your family? What advice would you give to someone that maybe is considering going into healthcare, or even maybe they're in med school, and I know that you would love to have more people stay here in West Texas. So what would you say to them if they're thinking, maybe rural healthcare is for me?
Yeah. I think the message is, if you're a student watching this, if I can go to medical school, you can go to medical school. I don't consider myself an intelligent person, but I'm a pretty hard worker.
Well, I would. I mean, you're a doctor, but...
Well, and I think...
But I'm glad you said that, because a lot of people, that maybe stops them from going into medical, because they think, well, maybe I didn't get all A's in high school, right? So,
I did not.
Tell your story. Were you straight A's? Were you C's get degrees? What were you?
I did not have a 1600 on my SAT, which is a perfect score. And in fact, when I graduated from college, and I was pretty high in my class at Del Rio High School. I was not sitting in the valedictorian seat, but I was pretty close to her.
Nice.
She became a psychiatrist.
Nice.
And so when I graduated college, I didn't get accepted to medical school.
Okay.
And my dream was to go to medical school.
Right.
And I was a paramedic at the time. I'd become a paramedic during college. And I thought, well, maybe I can go back to Del Rio and be a paramedic. I really enjoyed doing that. But I said, no, my community really needs me to go to medical school. So I applied to graduate school, trying to improve my GPA and, have either find a second career as a PhD or, hopefully have a second chance to go. And so I finished my PhD and went out to the CDC in Atlanta and did my dream job as a PhD. As a postdoc. I worked on hantavirus, and I wore a spacesuit for a year.
Wow.
Worked in the biosafety level 4 lab.
What was that like?
The most isolating year of my life.
Really?
Because often I'd go into the lab and I'd be the only one in there wearing this big spacesuit with air coming into this suit, and this wasn't my calling.
Gotcha.
So I retook the MCAT.
I'm glad you said that, because it's just as important to know what you don't want to do as it is what you do want to do.
That's right. So I retook the MCAT, did much better the second time around, and reapplied to medical school, and thankfully had a second chance to go to medical school. Mm-hmm. So, really, you have to have some level, degree of intelligence, but I think that perseverance and hard work in anything, not just in healthcare, but in life in general, overcomes many, many challenges if you just follow your dream and follow your calling. Mm-hmm. And to the local students, there are two predictors of a future rural medical practice. Okay. And those are, one, rural origin, and the second is no matter what's your origin, where you're from, but just having exposure to rural medicine during medical school and or during residency. And we know that the student who's most likely to stay and serve in the Permian Basin or the Big Bend in West Texas is that student who's from West Texas, who has family here, who's invested here. Perhaps their life partner is also from here. Yes. And so we really want to enable rural students and students from this area to have an opportunity to access education here locally, whether it be Midland College, Odessa College to start, UTPB, Sul Ross State University, Howard College. And then we want to retain you at Texas Tech Health Science Center in our different healthcare training programs. And then we want to train you, if you're a medical student, we want to keep you here for residency. And then we want to keep you in the community and in the region, and we want you to be faculty as well to help us train
the next generation. Yeah, I love that. And we're going to talk more about that and how someone can get started in just a second. First, we do what we call quote of the day, Dr. Billings. What we do is you pull one out and you tell me what it means to you. This quote. Which card did you get?
I chose friendly.
The friendly card, which, I mean, right? He's the most friendly person. Well, I love that you got that. What does the quote say on the back?
Oh, okay. Things work out best for those who make the best of how things work out. John Wooden.
What does that mean to you?
Yeah, so when I saw friendly, before I saw the quote, I was just thinking, this is really, I think, what makes West Texas very unique, is the folks here, the patients here, they're salt of the earth people.
Yes.
And they will give you the shirt off their back if you need it, even if they don't have the means to offer that. So I think, how that ties into, my recruitment message to the students that may be listening is we want you to stay because the people here, they deserve and they need and they've earned great health care.
Agreed.
And we think we want y'all to provide it. But yeah, this just says that, when you get handed lemons, make lemonade out of them, I guess, is another, euphemism that this makes me think of. But John Wooden is such a great inspirational basketball coach, right?
Yes, that's right.
UCLA or USC, one of them.
John Wooden, USC, UCLA?
USC.
UCLA. Hey,
Okay,
good
but
job,
yeah,
good job.
legendary basketball coach. But
He's my phone
also,
a friend.
Right. But also very motivational. The speeches that I've seen of him, I think he's now passed away.
Yeah, I believe so.
Yeah, but yeah, friendly.
Love
and
that.
yeah, I hope that I hope I do come across as friendly. I think
Absolutely.
That's what
I've just met you
patients
today.
Want. That's what our patients want, is their healthcare provider to be friendly and be kind of seen as part of the family.
Yeah, talk about good bedside manner, right? I mean, anyone would feel comfortable telling you what's going on. Matter of fact, let me ask you a question. No, I'm kidding.
Sure.
I want to know your favorite quote, because I know, there's either it could be a quote, Bible verse, something that you've lived by that you want to share with us.
Yeah, one of my mentors, who's also now passed away, was a physician at Harvard, at Massachusetts General. He was an infectious disease physician, but he was an advocate for those who don't have access to health care. His name is Dr. Paul Farmer. And my favorite quote that I'm sure everyone here has heard from Texas Tech many times, and my kids roll their eyeballs when I say this, is that our most significant professional accomplishments in life are done in partnership. As a team.
Good.
Another wording of that is, many hands make a great task small, but it's the importance of teamwork and collaboration. I certainly can't provide the best healthcare alone. I need a team.
Yes.
And that team is everybody from the receptionist to the nurse to the medical student and resident working with me that day, and then my family and my team at home that supports me to do the work that I do. So yeah,
I love
my
that.
favorite quote.
That's a great quote.
Yeah.
And kids, go ahead, roll your eyes.
That's right.
I love that though, because it's so true. And so speaking of teamwork, let's talk about what it takes. So somebody is they're graduating high school right now, or their kids are graduating high school. They've maybe thought about med school. They're not sure. We have some amazing programs here locally. So let's talk about those, so we can maybe give someone the information that could change the trajectory of their life and get more people to stay here in West Texas and be physicians.
Yeah, so, this perspective comes from, I'm a school board trustee in Alpine, and I've raised 3 kids now who have all been publicly educated in Alpine, and a lot of the work that I do with Texas Tech is getting out into our high schools and universities in the region and talking to kids about it. So we have amazing schools here, and we have amazing teachers in our public K through 12 schools and our private schools. Our administrators at these schools are amazing, and they really have your best interest as a student in your academic success, and we want you to follow your dreams. And again, the message I gave a while ago, if you put your mind to something and follow and recognize a calling, you can become whatever that calling is. And you don't have to leave the region to go to college. I mean, it is great to go and have another experience, but the academics are very robust here at Midland College, at Odessa College, at UTPB, at Sul Ross State University in Alpine, and Texas Tech University in Lubbock. And you can achieve any dream at any of those institutions. And certainly if you decide to go into healthcare, we hope that Texas Tech University Health Science Center is your academic health center of choice, because we want to keep you, we want to train you here. And we want you to have the opportunity while you're a trainee to maybe take care of your former teachers and maybe take care of your family members and stuff and see that. And then we want to retain you here in our different residency programs that we have here in the Permian Basin and or in Lubbock or
so
Amarillo.
They can do clinicals here.
That's
they don't
right.
have to
all
go
their
somewhere
clinical
else.
training.
Okay.
Yeah. So a high school student that's interested in going into pre-med, they can choose any higher ed institution in this region and achieve that bachelor's degree here locally. And then for medical school, they can go to TTUHSC, and all of our medical students do their first and second year in Lubbock.
Okay.
But then they can come back to the Permian Basin campus, which Odessa and Midland. We have 30 third-year medical students a year and 30 fourth-year medical students a year, and they can do all their clinical training here. They can get out to Fort Stockton and Alpine and do some rural medicine experience, and then residency programs here. What we offer here is family medicine residency, internal medicine, psychiatry, OBGYN, and internal medicine. Those are the local residency programs that are available here. And then our fellowships and we're working to begin a pediatrics residency here. That is in the works. And then we have various fellowship programs here as well, that if you decide you want to go in and specialize further through a fellowship, there are multiple fellowship programs here that you can do as well. But the message is we want to do everything we can to home grow the solution to our healthcare workforce challenges out here. Midland, Odessa, and certainly our surrounding rural areas, they're all medically underserved areas, or health professional shortage areas is how the federal government refers to those. So the good thing, the silver lining in that, is that there are various state and federal scholarships and loan repayment programs that enable you to graduate without any educational debt.
You just read my mind. You read my mind.
As you're willing to practice in one of these medically underserved areas, which is almost all of our counties out here in West Texas. So, and that educational debt can be paid off all the way from a potential associate's degree all the way to a medical degree.
That's fantastic, because you literally read I was thinking, let's talk money, because money can be something that may hold people back, right? When they think, okay, further education, that's a lot of years of school that I'm going to have to be paying, or my parents are going to have to pay, or I'm going to take loans out. So how reasonable is it for someone that maybe doesn't have a college fund set aside? So you said there's scholarships.
Yeah, there's,
Let's talk about, what does that look like?
There's also, I think incredible foundations in the Permian Basin that are really recognizing, supporting students so they can achieve their academic dreams, whether it's healthcare or outside of healthcare. So there are always those opportunities that are available locally, but also, especially related to healthcare, at the state and federal levels, there are programs to help you, again, graduate, debt-free. So when I graduated medical school, I had no debt. I just owed, because of that National Service Corps scholarship, I just owed 4 years in a medically underserved area of my choosing. I got to choose it. And after those 4 years, I was free to go, but I didn't want to leave because Alpine became home.
Yes, fantastic. Well, thank you for sharing that today. I'm so excited that we can get this message out. We want to get people to stay here. I love West Texas, and I think the sentiment is growing. I think more and more people are really feeling that and wanting to come back and raise their families here. So hopefully we can get that message out today. I want to ask you, what is the funniest thing that's happened to you as a doctor?
Oh, gosh. Funniest thing that happened as a physician. I think just, I remember being at a football game, and I've been the volunteer football physician for the high school for Alpine for the past 18 years. And the athletic trainer always knows where I sit in the stands, and one of the student trainers or she will kind of wave at me. I don't go down for every injury, and I sit with my family in the stands, and so I just wait until she needs me. Well, this time she didn't page me by waving her hand or making eye contact with me.
Over the
well, that's what happened.
Oh, no.
So the announcer came on and said, and everybody's quiet because there's a player down and he's not moving, and the announcer says, "Dr. Billings, you're needed on the field." And so I stand up. I'm the only one standing up, and I'm kind of sitting in the back of the stadium seating, and I start walking down, and then people start clapping. And then the whole crowd is clapping for me, and I feel like a rock star. Like I figured this must be what it's like to be a rock star. And I look back at my wife and I'm smiling, and she's just so embarrassed. Thankfully that I got down on the field, and the football player was one of our football players. He was fine. But it was that was really unexpected and funny in a sense, I guess.
Right,
but
that
also
is
a little
funny.
bit embarrassing.
But I love it. You're better than a rock star because you save lives. Let's be honest, rock stars don't save lives.
I wish I could sing.
You are better than a rock star. Okay, if you could sing, what song would you sing?
Oh, yeah. So I was anticipating this question for my homework.
Oh, good.
So one of my favorite songs, which is a song about gratitude, is from a Lubbock-based band called the Josh Abbott Band.
Yes.
And I was introduced to them about 6 months ago. They came to Sul Ross State University in Alpine and did a benefit concert. And they have this song called The Luckiest.
Okay.
And not everybody may know this, and so I've got it pulled up.
Oh, good.
So I'm going to read.
So this is your jam song, right?
Yeah.
You're walking in a room. This is what's playing.
For the audience, don't worry. I'm not going to sing this. But some of the lines that I think, again, express this idea of gratitude, which is really about kind of my journey in medicine and how much gratitude I have for having that second chance to go to medical school and try and pay this back. But the Josh Abbott Band, the lyrics are, did I find the field of four-leafed clovers somewhere along the way in another life? Did I need a genie in a bottle? Did I make the same with all those times? Because I don't know what I did for all my stars to line up like this. I'm lucky that I come from where I come from, and I'm lucky I got friends that got my back. I'm lucky God made Friday nights with a beverage, and that I've had all the good times that I've had, and I'm lucky King George still makes country records. I can't believe the life that I've been given. Yeah, I'm lucky, and I know it's true, but I feel the luckiest to be loved by you.
Oh, I love that.
To my wife out there, this is what I wrote in her Valentine's Day card this year.
That is so sweet.
And I gave
now everyone's crying.
I gave the Josh Abbott Band credit. I didn't take credit for that poetry. So.
Everyone's crying, and all the guys are going, thanks, man. Now I got to step it up next year.
Yeah, Josh Abbott Band. So,
I love that. That's great. Thanks for sharing that. Okay, we are sitting here today in Midland, Texas with Dr. Adrian Billings having a fantastic conversation about all things health. And now we're going to do the question of the day. So, Dr. Billings, if you could please pick out a question.
Okay.
Okay, which card did you get?
I chose the trusting card.
Yes, because you have to trust your doctor, right?
Oh, yeah,
I love that.
hopefully so. I hope so.
So what is your question, let's say?
Yeah. Oh, this is good. This is what I gave a lecture on Monday, and part of it was about finding your who and your why. What is your who or your why?
Ooh, I love that.
Yeah.
So tell us, you gave a lecture, you're prepared.
Yeah.
What did you say to those great students in the audience?
Yeah, and medical students in their third year is when they get exposed to all the different specialties. They do rotations in different specialties. And at the end of that third year, they have to make one of their most significant professional decisions at that time. What kind of physician do I want to become? Do I want to become a surgeon? Do I want to become a generalist, like a family physician?
Right.
And what I tell them is, find your who, try and figure out who your who is, try and figure out your why you want to become who you want to become, but more importantly, who you want to serve for the next 30 or 40 years. Don't worry about the title of super subspecialist if that's not your who, your why, and your calling. Don't worry about the money. Physicians, no matter what kind of physician you make, you make a blessed living compared to 99% of the population. And really, what keeps you from burning out in medicine is serving the who and the why that you feel called to. And so certainly, I had the incredible blessing and privilege of growing up in a rural community, spending lots of time in rural communities as a kid, and knowing that was my who. And the why is really a rural zip code should not be a risk factor for somebody's health.
Right.
And so my why is trying to improve healthcare access to care issues for our rural residents that produce the food, the fiber, and the fuel for our region, our state, the nation, and really even for the world. I want rural residents, rural patients to have access to care that they have earned and they deserve. And so the message to trainees is always, just figure out your who and your why may not be the same as mine,
right,
but just try and figure that out. And I tell high school students, and what I was telling high school students yesterday, you don't have to know that yet, but be curious about the world around you and while you're in college or trade school or what, and try and figure out your who and your why, because then the paycheck doesn't matter. You want to wake up every morning happy to go serve and try and do good deeds and improve things for your community and your region.
And I love what you said about being curious, just like Ted Lasso said, just be curious. But it's okay to change too.
It is.
You don't have to decide.
Yeah.
I mean, look, you
That's
said
right.
you made a change 10 years ago, and
That's right.
and I
Yeah.
love that you just kind of have to listen to your gut and your heart and what
Yeah.
and
Yeah.
don't get too locked in, right?
That's right.
It may change through the years, and that's okay.
Yeah, follow your heart.
Yeah.
And once you figure out your who and your why, the how will make itself apparent to you. But figuring out that who and the why, don't worry about the how yet. Just figure out the who and the why, and that how becomes then immediately available to you.
I love it. Okay, number one health tip. Right now, someone's listening.
Yeah.
They're ready to make a change in their health and what they're doing. What do you suggest they do?
Yeah, I think there is no true fountain of what youth or whatever it's called.
There's not. I'm looking for it. I haven't found it yet.
But there are some things that you certainly can do.
Right.
Is stay active.
Okay.
Exercise. And exercise looks different for everybody. It may not be running, but it may be biking, it may be gardening, it may be running. Eat a healthy, healthy diet. Eat lots of fruit and vegetables. That should be 50% of your plate. And then abstain from substances, from using them regularly, whether it be alcohol or tobacco products. So those are some very common things. But then also...
Is coffee okay?
I think coffee's fine. Yeah,
okay,
coffee's
good.
fine in moderation.
A friend of mine just brought some coffee, so I'm just checking.
And I think, so that kind of impacts your physical health. But I think what is so important mentally, that also bleeds in and impacts your physical health, is love more.
That's so good.
And share gratitude. And, tell your loved ones, don't miss a day where you're not telling somebody that you love them.
Yeah.
About 6 months ago, I don't know what happened in my life, but I just decided I'm going to start being more intentional about telling my patients that I love them. And, and I tell the trainees, I didn't do this to the new 13-year-old female patient that I see, but patients that I've, had a relationship with for many years and maybe taken care of generations of their family. I've just become intentional about telling them, either at the beginning of the visit or at the end of the visit, you know what, patient X or Y, I love you. And thank you for the privilege of letting me take care of you. And what's been so beautiful is the unintended consequence of that. Alpine's a small community, and maybe people are going off on social media. Dr. Billings off is a rocker, and he's starting to tell everybody that he loves them. And but
there's worse things to be said about somebody, right? Someone sharing love. That's a great thing.
The wonderful thing that has happened is that reciprocation that has happened. Even before I can get to the intentionality of telling my patients I love them now, oftentimes, either as soon as I walk in or right before I'm about to tell them, they will tell me, Dr. Billings, I love you, and thank you for staying here, and thank you for being at Texas Tech and being our cheerleader for healthcare resources. So.
Yeah. Because at the end of the day, that's what everyone wants, right? They want to be seen, they want to be heard, they want that they're not alone and that they're loved. And I love that you're providing that with your care. That's fantastic.
So eat healthy. I didn't say sleep 8 hours a night at least.
Oh, that's a tough one, but yes.
Avoid substances and love more and dance more. Maybe that gets back to the exercise part.
I like that. So. I like the dance more. There's nothing better than a good dance session in your kitchen to some loud music, right? To get you, I don't care where you're at in your day. If it's the end of your day, that'll bring joy. If it's starting your day, that'll bring joy. I love that. Right. Great tips, great health tips. Okay, we are going to talk about favorite things now. Okay, you ready?
Yeah.
So I'm going to start with, because of your love for Alpine, and we love Alpine too, if you want to say your favorite restaurant in Alpine or Midland, Odessa. You pick, but favorite restaurant?
Oh, that's a hard one. I love all food. Like, I really love all food. But, I think it's always home-cooked food.
Okay.
Either at home or in my parents' home or, my grandparents' home in their kitchen. And just, sitting around at holidays and having, meals together with friends and family. But, yeah.
So favorite dish? Spaghetti?
Favorite
I love food too. I just want to hear your favorite.
We do not have Indian food in Alpine. So when I travel, I always seek out Indian food.
Nice.
And I love a good goat or mutton curry.
Oh,
I love
that
goat
sounds
meat.
so
I was
good.
raised
I love curry
eating
too. Yes.
goat meat, and so I love goat meat.
Nice. Awesome. Okay, favorite book?
Favorite book? And I did think of this as I was preparing for this. Again, it relates back to this idea of impact and this idea of practicing medicine outside the walls of the exam room. There's this book, actually from 1972, which was written by a 21-year-old legislative aide. He had just graduated from Harvard. The book is called The Dance of Legislation by Eric Redmond. But essentially, it's the story of how the National Health Service Corps became a bill in Congress and was signed and became law. And it's impactful to me because,
it's what you do.
40, 30 years later, that program enabled me to go to medical school and really enabled me to come back to West Texas and remain in West Texas.
Great.
But the story of that really shows how community people can have an idea that becomes a law and that can save lives. So the story in that book is there was this community pediatrician from Seattle who came to Senator Magnuson's office, who was the senator in Washington, D.C. at the time for the state of Washington. And he was this loud, kind of boisterous, we need to create this program to send physicians to medically underserved areas. And so he kind of got assigned to this young 21-year-old recent Harvard graduate, Eric Redmond, said, deal with this doctor and see what he wants to do. But it's this story of really the networking and the relationships that were needed to make this bill into a law. But the foundation and the root and the seed of this came from the community, from a community pediatrician.
Best things do, right?
It just talked about the possibility of the good that can come out of our state and federal governments that begin with the idea in the community. And so that's really impacted my advocacy work and my attempt to also create programs that help improve access to care for our region.
Love it. All right, sounds good. Favorite podcast?
Oh, favorite podcast. Oh gosh, well, the Krista Escamilla show, obviously, right?
Thank you.
You dance with the one who brought you. But I travel.
I'll give you a hat for saying that later.
I travel a lot, so I have a lot of windshield time.
Nice.
And I speak Spanish.
Very well, by the way.
I love speaking Spanish. I'm not fluent and I'm not a native speaker, but that was one of the benefits of growing up in Del Rio, and my parents both speak Spanish as well. So, and I've taken care of a lot of Spanish-speaking patients, over the years. So I listen to Duolingo Spanish podcast on my drive up to help improve my Spanish and keep learning my Spanish. And it also helps me because my 8th grader, 5 years ago now, I said, you have to do Duolingo every day. And so I also tell him, well, I'm doing my homework, so have you done yours today?
I love it. That's fantastic. That's funny because, fun fact, when Al and I got married, I did Duolingo every day for a year. Awesome. So muy bien to you.
Muy amable, gracias.
And that's about the extent of mine, so I need to listen to that podcast. That is fantastic. Okay, favorite, now you're a big Paul Harvey fan.
Yes.
So am I. And now for the rest of the story. Tell us a fun fact about you that we wouldn't know just by reading your bio.
Yeah. So in high school, I was an athlete. I ran track. I played football. But my senior year in high school, I decided, I think I'm ready to get out of the football team, and I think I want to become a male cheerleader. And there were no male cheerleaders on the Del Rio cheerleading squad at the time, and so they let me join it. I didn't even have to try it out. So my senior year, I went from the football field to the, the sideline. And at the same time, I was also on our high school rodeo team, and my event was bareback riding, which is a rough sport event. So I was a bareback rider in high school and a cheerleader.
I love this.
And so
I think this might go down as one of the best fun facts I've heard about someone.
And it's so fun. I've been to my 10, 20, and 30-year high school reunions now. And every reunion, all 3 of those reunions, the cheerleaders, we've all got together and they've said, Adrian, come on. And we have to do some a cheer that I hadn't remembered, but it's fun just to be part of that. And it was, actually the gymnastics that I learned being a cheerleader and doing that tumbling, that actually benefited me as a bareback rider.
I bet. If you fall off the horse,
that's right. You
can do a somersault and be ta-da.
Yeah, so maybe that's those 2 things. I was a bareback rider in high school, and then I was a cheerleader.
I love that.
Go Del Rio Rams.
That is fantastic. Great fun fact. And God was just preparing you to be a rural health cheerleader. Is what
that's right.
He told me his title was today.
Yeah.
I love that.
Right.
Okay, favorite, let's go favorite memory in West Texas.
Oh, yeah. There's so many. I think really just being accepted as part of the community, raising my sons there, and 2 of my sons that are now in college and medical school, think they want to become rural physicians, and having them shadow with me. They've shadowed with me, those 2, over the past couple of years, and they're both headed to Texas Tech Health Science Center, and hoping that they come back and rotate with me as their medical students. But also just, my wife. My wife is a physical therapist, and she's a pediatric physical therapist, and obviously there's no children's hospital in the Big Bend. And so she really thought she was going to have to give up her career or retrain as an adult physical therapist when she moved to Alpine.
Yeah.
But she got a job with our school. There's 13 rural school districts from Sanderson to Sierra Blanca to Presidio to Balmorhea that co-op together to provide physical therapy, occupational therapy, speech therapy for educational-based reasons. And she's their lone PT. And so it's so fun. Also, I'm not the only one that get consulted in the grocery store.
Right.
My wife gets consulted in the grocery store. But
if I was walking past her and I had a little ailment, I'd be like, hey, what can I do for this? Yeah.
But seeing her get consulted as well, and knowing that, she's also been able to give back to the community. And she's truly kept us there, in Alpine. And there were times where I thought, maybe the grass is greener elsewhere. Why don't we move to this other place? She said, no. This is our children's home. This is our home. We are needed here. You are needed here. You're staying. Suck it up.
Suck it up, Buttercup.
But just having her, she grew up in the suburbs of Dallas-Fort Worth, but truly, she is now a West Texan.
I love that. We are coming to the close of our podcast, and I just want to first of all thank you for what you do for West Texas and how you are training up the next generation and all that you've given back to our rural communities, because it is so needed, because everybody deserves good health care no matter where you live. And so thank you for that. Is there anything that coming into the podcast you're like, oh, I hope we get this out, and we didn't, and now is your chance to get it off your chest and share with all of our listeners today?
Yeah, no, I just, I want to say thank you, and thank you to what you do for the community, and highlighting the joys that we have out here, and also the challenges, and just knowing that we collaboratively together, we have the resources here to solve any problem. If we just decide this is what we're going to do, we can solve that problem. And if it's healthcare, then let's tackle that collaboratively together. Again, many hands make a great task small.
I love it. I love it. Thank you. And you're a busy guy. You're already getting texted.
Sorry about that.
A patient needs you. We got to let you go. Finally, back in 2020, I used to ask everyone, because we were going through such a hard time, tell me something good really quick. Tell me something good.
Yeah, something good. The people here in West Texas are amazing, amazing people. And can't imagine practicing, serving anywhere else.
Thank you so much. We appreciate you. Dr. Adrian Billings with Texas Tech Health Science Center. Please follow them on Facebook, on Instagram. Stay connected. They're doing amazing things in our community. And to find out more about being a rural health cheerleader like he is, you can follow along with what they're doing. We need more people to learn here, stay here, and share their gifts here. So I love your message today. I appreciate you.
Krista.
Thank you so much.
You.
Thank you for listening. Share this with someone you love. We want to keep the podcast going. We're reaching more states, more countries throughout the world, and we want to continue to do so to shine a great light on West Texas, because it truly is the best place to be. And we hope if you're not from here, you come visit us soon. So share this with someone you love. A big thank you to all of our sponsors. So thank you to Omni Midland Hotel, Rig ID Workwear, to the Laughlin Hotel, Kevin Foreman of Foreman Financial, Thin FR, Midland Cap Company, and The Preserve, which is under construction, will be opening in a few years. So we want to thank our new sponsor, The Preserve, and we want to thank you, the listeners, because without you, hey, we would just be sitting here talking in a room and no one would be listening. So thank you, thank you, thank you. As always, remember my mottos: dream big, believe, and never give up. You make it a great day.